All right, so we're gonna go over block 1 in medical. So the first part of block 1 is gonna be our BSI, our PPE, and our penman. Okay, so we're gonna walk through what each of those mean. So BSI is going to be your body substance isolation. Your PPEs are going to be your personal protective equipment, like your gloves, gowns, masks. And then when you go through penman, so remember the P is personal, then your partner, then the patient, then public, and we're looking at their safety. Then we're looking for any environmental hazards. Remember, environmental hazards are going to include like fire, gas from a gas tank of a car, your environmental hazards like snakes, my favorite one, like always, guys, the mighty Chihuahua. Then we're going to look at number of patients. Remember, you can have more than one patient on scene. So we've talked a little bit about triaging already, so we're going to triage those patients. M is going to be mechanism of injury. That is more for trauma. Nature of illness is what we're going to use for medical. So we're going to look at things like chest pain, shortness of breath, abdominal pain. Then we have additional resources. So on your call, if you need more ambulances, you need a fire truck, you need medevac, you need police, you're going to call for additional resources. And then the N is going to be need for extrication or extraction, as well as need for C-spine. Okay, so that is step 1 in medical. Then when we move on to step 2, this is going to be our general impression. So your general impression is going to include the age of your patient. It is going to include the weight of your patient, and we're talking weight in kilograms. The sex of your patient, whether they're male or female, and we are looking at the sex that they were born as. We're also looking for what position we find that patient in. Are they in tripod? Are they sitting up? Are they laying down, supine? And then we're going to look for any apparent life threats. Okay, because if we have any apparent life threats, we need to take care of those first, okay? After you get your general impression, then we're going to move on to AFPU. Remember, your AFPU is going to stand for alert. So if your patient is tracking you, they are alert. The V is going to stand for verbal. Remember, that means that they respond to your verbal pain, stimulus. Painful is when we're doing our trap pinch. And then the last one is going to be unresponsive. So if my patient does not respond at all, they're considered unresponsive. All right, now after we've done our AFPU, then that is when we're finally talking to the patient. So now we are going to do our introduction. We're going to introduce ourselves. So when we introduce ourselves, we're going to say, hi, my name is, I'm an EMT student. How can I help you today? Once you get your intro, your patient should give you what we call a chief complaint. Chief complaint would be like, oh, I'm having abdominal pain, I'm having chest pain, I'm having shortness of breath. So it depends on the patient on what their chief complaint's gonna be. After you get your chief complaint, you're gonna move on to ABCs. So A stands for airway. You guys are gonna check to see if it's open. If it's not open, you're gonna open it with either the head tilt chin lift, or you guys are going to do the jaw thrust. Remember, the jaw thrust is going to be for our patients that have spinal injuries. Then I'm going to check to see if my airway is not, if it's clear or not. If it's not clear, then you guys are going to suction. So remember, one of the things on here is need for suction. And then I'm going to check to see if it is maintainable. Okay, if my airway is not maintainable, remember another one of the things that you need to do is need for airway adjuncts. Okay, and remember those airway adjuncts are going to be my OPAs and my NPAs. Okay, So remember, those are going to be the airway adjuncts you guys will be using. After airway, then we're going to move on to breathing. And breathing, you guys are going to be looking for rate. Remember, the average adult respiratory rate is going to be between 12 and 20. You guys are looking for depth. Remember, when we think of depth, think of a swimming pool. So we're looking at the deep, right? The deep end of that pool, the shallow end of that pool. And remember, like I always told you guys, most of the normal people hang out in the middle, so we're looking for normal depth as well. Then we're looking for ease, whether it is going to be shallow. Okay, oops, sorry guys, not that. Let's try that again. Whether it's going to be labored or non-labored. Okay, so I've got rate, depth, ease. Now I'm gonna listen to long sounds, long sounds. Okay guys, there's lots of different long sounds we can have. I'm just gonna put a few up here for right now so you can have clear long sounds. We can have wheezing, we can have rhonchi, and then of course we can have those nice little crackles, okay? There are more lung sounds, but we're just gonna leave it at that for right now. Then we're gonna assess the SpO2. Remember, that's the light on the finger. Remember, your guys' average range right now is 94 to 100% is normal. And then we're gonna look for the need for O2. Okay, remember the devices you guys have are a nasal cannula, a non-rebreather mask, as well as a BVM. All right guys, so now we're moving on to circulation. With circulation, remember you guys are looking for rate. When we talk about the average adult pulse rate, we're talking about 60 to 100. We're looking for rhythm. Okay, remember you can have a regular rhythm, okay? Or we can have an irregular rhythm. Remember, if it is an irregular rhythm, you better check it for the whole minute, okay? And then I have rate, rhythm, and then I have quality. When we talk about quality, we want to know, is that pulse strong or is that pulse weak? Okay. Then we're going to assess skin signs. Remember, the easiest way I told you guys to remember it as is country music television. So we have color, we have moisture, and then we have temperature. Okay. After you assess your skin signs, I'm going to go down here a little bit at the bottom, guys. We're going to assess cap refill. Okay, remember with cap refill, if it is greater than 2 seconds, we call that delayed. If it is less than 2 seconds, we call that immediate. Okay, and then the last thing you guys need to look for is you're looking for hemorrhaging. Remember, with hemorrhaging on our medical patients, guys, it's not like trauma. We're not stripping and flipping our medical patients, guys. We're just assessing for hemorrhaging. And then the last part in block 1 is going to be that first transport. Okay, this is my first transport decision. Remember, you guys have 2 options. Your patient's either going to be a load and go, okay, or they're going to be a stay and we're going to continue our assessment. So stay and assess, all right? But in medical, guys, we have 3 load and go criteria, okay? They're the first 3 in trauma too, so altered level of consciousness. We're gonna assess for compromised ABCs. And then the last thing we're gonna look for is that uncontrolled hemorrhage. So if we can't control that hemorrhaging, that is a load and go, all right? And that is the end of block 1. Okay, walking in, starting with BSI Penman. Remember your BSI PP Penman, you need to walk through it. So we're gonna start with body substance isolation, personal protective equipment. So I have my gloves or any material that I need for this scenario. Then Penman, I have personal partner, patient, public safety. So my scene's safe, my partner's safe. Environmental hazards, doesn't look like we have any. Number of patients, it looks like I have 1. If there's the mechanism of injury or the nature of illness, we don't really know just yet. Need for additional resources, I'll kind of hold off. We'll assess the scene first and then determine that. And the need for extrication or C-spine, doesn't look like we need that at this time. Then I'm gonna get a general impression of my patient. Remember, that's age, weight, sex, position found, any life threats. So when I look at my patient, I have a male patient in his early 20s. He is sitting in the high Fowler's position. Doesn't look like he's kind of any distress. Don't have any life-threatening, any life-threatening hemorrhaging or anything that I can see from afar. And he looks like he is approximately about maybe 106 kilos. So after that, I'm gonna assess my AFPU. So this is the part I'm actually gonna start approaching my patient. I see my patient's looking at me, so he's tracking me. So he's an A, so he's alert on the AFPU scale. If he wasn't, then I would try to talk with that patient to see if I could get a verbal response. If he responds verbally, then he is verbal. If not, we would do the trap pinch for painful. And if he didn't respond to any of that, he would be unresponsive. So I'm gonna approach my patient, I'm gonna introduce myself. Hi, sir, my name is Instructor Science. I'm an EMT student. How can I help you today?
My chest feels very heavy.
Okay, so the patient's complaining of chest pain. So I know that his airway is open, clear, and maintainable, and there's no need for suction or airway adjuncts because he's talking to me. So I'm gonna move on to breathing. Again, remember we're assessing rate, depth, ease, lung sounds, and SpO2. So I'm gonna go ahead and get in my bag here, and what I'm looking for is I'm gonna look for that stethoscope. Remember, as a primary, guys, you're doing your own lung sounds, okay? Sir, are you okay if I place this pulse ox on your finger?
Yes.
Okay. And then I'm going to go ahead and listen to your lung sounds as well, okay? So I'm going to go ahead and listen on the front because it's a little bit easier. I would clean off my stethoscope so that way I could put it in my ears. And then I'm going to listen. Remember the top one, guys, we're listening mid-clavicular, and the bottom one's mid-axillary. Sir, can you take a deep breath for me? And let it out. And then do it again. Let it out. Okay, now I'm gonna go mid-axillary again. Let it out, and then one more over here, and let it out. Okay, so my lung sound clear, and then my SpO2 is coming back at 99% on room air. We're gonna check the pulse and compare it to that shortly, okay? I also need to assess respiration, so you guys are gonna count those for a whole minute. You guys can place your hand on the patient's back. That's kind of pretty easy to do to get your respirations. So for this scenario, I'm gonna change some numbers up a little bit so you guys can kind of see a more critical patient. So we're gonna say that his respiratory rate is about 30, okay? It looks shallow, it does look labored. So with those findings, I'm gonna go ahead and I'm gonna place this patient on a non-rebreather mask, okay? So I'm gonna grab my non-rebreather mask out of my airway, out of my oxygen here. And because he's having such a hard time breathing, I'm gonna go ahead and I'm gonna hook this up. We're gonna put him on 15 liters on this non-rebreather mask, okay? Make sure you guys take that O2 tank, stick it underneath that chair so no one trips over it. And then remember, before applying it, you guys are going to fill up that reservoir bag, okay? Now, I'm not gonna actually apply it to my patient here, so we're just gonna kind of drape it over, and that's a good indicator for us when you guys are practicing that it's on the patient, okay? But in the real world, guys, you're gonna actually put it on your patient, okay? Now we're gonna move on to circulation. Remember, checking pulse, rate, rhythm, and quality. We're gonna check our cap refill, our skin signs, remember color, moisture, and temperature, and hemorrhaging. So I don't see any uncontrolled hemorrhaging. Sir, are you okay if I assess your pulse?
Yes.
Okay, so again, guys, I'm gonna assess this pulse for 30 seconds and times it by 2. It is going pretty fast. So we're gonna say that we have a pulse rate. Remember, guys, I'm gonna change the numbers a little bit. We're gonna have a pulse rate of 110. It's gonna be strong and regular. And then I'm gonna go ahead and I'm gonna assess his cap refill. We're gonna say his cap refill has a slight delay to it, okay? And then I'm gonna check skin signs, so I'm looking for color. We're gonna say that he's actually a little paler than he really is. So we're gonna say his skin signs are pale. And then I'm gonna check for moisture. I'm gonna say that he's a little clammy or diaphoretic, okay? Again, guys, I'm just doing this for the scenario. So, and then we need to assess the temperature. Sir, are you okay if I place the back of my hand on your forehead? Okay? and we're gonna say that he is warm to the touch, okay? So we have now done our ABCs, and we have found that we have compromised ABCs, okay? We have him on a non-rebreather mask. We have compromised skin signs. He's not altered. He's still answering our questions really well, and we don't have any uncontrolled hemorrhaging. But again, like I said, we do have those compromised ABCs. So he is considered a load and go patient. All right, guys, so now we're moving on to block 2. Okay, so this is block 2 of your medical assessment. The first thing that we're starting off with is PPTP. Okay, the first P stands for person. So what am I going to ask? I'm going to ask my patient, what is your name? Okay, these are questions that the patient should be able to answer because we're going to assess how alert and oriented they are. The second P is place. There's a lot of different things you can ask for this, but I'm just going to write on here, where are we? Okay, so we're going to ask that patient, where are we? Okay, if they maybe can't answer that, maybe I'll ask them what city we're in or what state we're in. All of those would be good questions to ask, okay? Then we have time, okay? You can ask time of day, you can ask morning, afternoon, evening. You can ask what year is it, okay? So this is all questions the patient should know. You can ask what month it is, you can ask what holiday just passed. We're looking at time, okay? Now your sheet actually says purpose for this last P. I feel like that's relevant if your patient's altered. If your patient's altered, it's not a bad idea to ask, hey, what brings us out again? But if the patient isn't altered, patients kind of get irritated when you ask the same questions more than once because they think that you're not listening, okay? So we will ask instead, who is the president, okay? And as you guys can see from these questions, we have no can use or do use, because you don't want to ask, can you tell me who the president is? Do you know who the president is? Because those are closed-ended questions. You guys want open-ended questions, okay? So if the patient can answer all 4 of these correctly, they are what we call ANO times 4. Okay, ANO, remember, stands for alert and oriented. Let's say they can only answer 3 of these correctly. They would be ANO 3. Only 2, ANO 2. Only 1, ANO 1. If they can't answer any of these questions, we would consider them ANO times 0. And then based off of the alert and oriented, will depend on where we go next for our assessment. If your patient is ANO times 4, meaning they can answer all of those questions correctly, we're going to move on to O, P, Q, R, S, and T. What does that mean? So remember, O stands for onset, P stands for provokes, Q stands for quality, R stands for radiation, and S stands for severity, and T stands for time, okay? What question do I ask for onset? Remember, we want to ask, what were you doing? Okay, what were you doing? Okay, oh, sorry guys, can't spell today. So, what were you doing? Okay, when the chief complainant started. When the chief complaint started. Remember, we're going to write chief complaint because you can ask any of these questions as long as you can throw chief complaint in there. Provokes, we're going to ask, what makes it better or worse? So when we say it, we're going to again erase that and put chief complaint. What makes that chief complaint better or worse? Okay. Quality, we're going to ask them to describe that chief complaint, and we want them to describe it in their own words. Okay. So in their own words, do not put words in your patient's mouth. Let them describe it. Radiation, you're going to ask them first to point where the chief complaint is. So point where chief complaint is located. After you know where it's located, then you're going to ask them if anything with that chief complaint moves. So if it moves and they say, yeah, it does, then you're going to ask them to show you where, okay? Where does it move to, okay? Then we're looking at severity. So we're going to ask them on a scale of 0 to 10. Remember, 0 means no pain, guys, or not having a hard time breathing. Okay, so on a scale of 0 to 10, can you rate your chief complaint? Okay, and then time, we're going to ask them, when did this chief complaint, okay, when did this chief complaint start? Okay, so this is basically going to let me know, was this more of a sudden onset? Was this more of a gradual onset? How fast did this chief complaint come on? Okay, so that would be for alert and oriented ×4. And then I'm going to move over to the other side of the board, and I'm going to show you guys if my patient was ANO ×3 or less, then we got to go a different route. Okay, we're going to ask our AEIOU tips questions. Okay, I would suggest if your patient's that altered that you guys ask these questions to family members, okay, maybe friends that are on scene, and even maybe bystanders, okay? That's who you guys want to ask these questions to. Because remember, if your patient's pretty altered, they're probably not going to be able to answer these very well. But you can always try, okay? So the A actually stands for alcohol. We're going to ask them if they've had anything to drink. If so, how much and of what, for sure. Then we're going to ask epilepsy, okay? For epilepsy, we're going to ask them, do they have history of seizures, okay? I stands for insulin. So we're going to find out, is this patient a diabetic, yes or no? We definitely want to know type 2 versus type 1, because remember, your type 1s are insulin dependent. O stands for overdose. U stands for underdose. Now remember, with your AIU tips, there are actually additional things for some of these letters, but these are the main ones that we're going to focus on. T stands for trauma. So we're going to find out, has the patient had any possible trauma that we need to be aware about? I stands for infection, so maybe an illness or sepsis. P stands for psychosis, so remember psych patients, and then S stands for stroke. If we're suspecting a stroke, remember we need to do a stroke assessment. So you're going to have your patient smile, you're looking for slurred speech, you guys are going to do the hand grips, the arm drift, and then the pushes and pull on the feet. All right, so after you guys ask either OPCRST or your AEIOU tips questions, the next set of questions you guys are going to ask is your sample. Okay, so we're going to look for sample. Remember, S stands for signs and symptoms. We're getting all that information, okay? Signs are our vital signs, things that we can see. Symptoms are the things the patient tells us. A is going to stand for allergies. Remember, we want to know if they have any food allergies, any medication allergies. Medication allergies is a big one. And then any environmental allergies. Okay, all of these allergies are really important to ask. Then we're going to ask, are they currently taking any medications? If so, what medications are they taking? Okay, so we want to know current medications, guys. We don't want to know medications they took a long, long time ago. Okay, then we're going to ask for past medical history. So remember, this is kind of your past medical history or past pertinent medical history. Remember, I always tell you guys just to ask them, hey, what are your medical problems, okay? For some reason with patients, when you ask medical problems, they're like, oh yeah, so I have all these medical problems. If you have a patient that says, oh, I don't have any medical problems at all, but they give you a list of like 20 medications, just ask them what they take those medications for. L stands for last oral intake. So we want to know the last thing the patient had to eat. We want to know the last thing the patient had to drink, and we also want to know any medications the patient took that day. Remember, the medications are important so we can make sure that they are current with their meds. Maybe the last thing they had to eat or drink is the reason why they're calling 911, or maybe the patient may have to have surgery and we need to know that information. The E stands for events leading to basically the present illness. Remember, the main question for events leading to present illness we want to ask is, has this ever happened before? Okay, so has this ever happened before? This is the question you guys always have a hard time with We want to ask them, hey, have you ever called 911 for this before, kind of thing? Because remember, if it has happened before, then we can have them tell us what happened last time and if the treatment that was provided actually helped the patient or not, okay? So I'm going to move on over to the other side of the board and finish up block 2. So now at this point, guys, we're going to do what we call additional questions or clarifying questions, okay? These additional clarifying questions are questions that are not part of OPQRST or sample that you need to ask for a specific chief complaint, okay? And I will show you guys as I'm going through this assessment for you guys, I'll show you an example of what additional questions are. Then you guys are going to assess the area, okay? So if you have a patient with chest pain, you're going to assess the area just like you do for trauma. You guys are going to expose the area, you're going to palpate the area, and then like we already listened to lung sounds, so we don't need to worry about doing that again. And then we're going to do the remainder of our vitals because we haven't finished our vitals yet. So we're going to get a blood pressure, we're going to assess the pupils of that patient, and we're also going to assess what is my blood glucose, okay? For blood glucose, guys, we're only doing this on patients that have history of diabetes, that are altered, or maybe they haven't eaten in a few days, so we should probably check that glucose level. And that is the end of block 2. All right, guys, so just remember that we have just finished block 1. Remember, we determined that this patient is a load and go, but this is information we would be gathering on the patient as we start loading them up on the gurney, okay? So we're gonna start with our ANOs. So ma'am, I have a couple questions I need to ask you. They're kind of silly questions, but I just need you to answer them for me. What is your name?
Andrea.
Andrea, okay, nice to meet you, Andrea. Where are we?
At school.
You're at school right now?
Yes.
Okay, all right. What year are we in?
2024.
Okay, 2024. And then who is our current president?
Sleepy Joe.
All right, Sleepy Joe it is. So our patient is alert and oriented ×4, so that means, remember, that we're going to now move on to OPQRST. So you said prior that your chief complaint was chest pain, so I have some more questions regarding your chest pain.
Okay.
What were you doing when that chest pain started?
Well, I was helping my husband work on the car.
Oh, okay. All right. Overexerted yourself maybe a little bit?
Maybe, I'm not sure.
Okay, all right. And is there anything that makes that chest pain better or worse?
Just sitting down and just breathing kind of helped a little bit.
Okay. What about that oxygen? Is that oxygen helping you a little bit?
It is, a little bit.
Okay, awesome. And then can you describe it for me? What does it feel like?
It feels really, really tight, and it feels like a sharp pain just shooting in.
Oh, wow. Okay, all right. Can you point to where it's located for me?
Yes, it's right here.
Right there. Okay, and does it move anywhere?
It feels like it's going to my arm a little bit.
Yeah, which arm?
To my right arm.
To your right arm?
Yes.
Nowhere else, just that right arm?
I had nowhere else.
Okay. And then can you, on a scale of 0 being no pain, 10 being the worst pain, what would you rate that pain?
About a 7.5.
A 7.5 out of 10. Okay,
yes.
So that's pretty bad. Okay. And when did this chest pain start?
Well, it started about like a little bit before we started working on the car.
Yeah.
It was just kind of minor, and then as it progressed, then it kind of got worse.
Okay, so how long ago did you guys start working on the car?
Let's see. I want to say about 7 a.m. this morning.
Oh, so it started at 7. When did it get progressively worse?
Around like 20 minutes ago.
About 20 minutes
Yes.
ago, it just got really bad. So it's been kind of lingering all day. Has it come and go, or is it just staying?
No, it just kind of stayed, but I just was hesitant to call.
Okay, so it's just getting progressively worse as
Yes.
we get through the day. Okay. All right, so now we can move on to sample. Remember, for sample, you're getting your signs and symptoms. So your vital signs, the things you're seeing on your patient, that's all your signs. The symptoms is part of like your OPQRST, where I'm asking the patient questions. So we just ask ample questions. So I'm moving on to allergies. Ma'am, do you have any medication allergies at all?
Penicillin.
You are allergic to penicillin. Penicillin, okay. Any food allergies at all?
I do have a nut allergy.
You have a nut allergy,
Yes.
okay. And then any environmental allergies we need to be aware of?
No.
None at all, okay. Are you currently taking any medications?
No, I'm not.
No medications at all. So that peanut allergy you have is not severe enough to carry an EpiPen at all?
I do have the EpiPen, but I never use it.
Okay, but you do have one?
Yes.
Okay, is it actually expired or not expired?
I don't know because I don't eat peanuts. Why eat them if I'm allergic to them?
Okay, smart. All right, so no other medications though. We don't have like aspirin, nitro.
No.
No, none of those. So you've never been prescribed any of those?
Nope.
Okay, all right. So then I'm gonna move on to what kind of medical history do you have?
Well, I had surgery a couple years ago.
Okay, what'd you have surgery for?
Appendicitis.
Appendicitis.
Yes.
So you've already had your appendix taken out
Yes.
then? Okay, all right. Then I can move on to my last oral intake. So what was the last thing you had to eat?
Chipotle.
Chipotle.
Yes.
What was the last thing you had to drink?
A diet Dr. Pepper.
A diet Dr. Pepper, okay? And you don't take any medications, so you didn't take any medications? You didn't take any kind of Motrin, Tylenol, anything like that for this pain?
No, I usually have a high pain tolerance, so.
Okay, so you don't normally need to take anything at all? Okay, all right. And then has anything like this ever happened to you before?
Nope.
No, this is the first time?
Yes.
Okay, so I have a couple more questions to ask you. So I noticed we had some shortness of breath earlier, and we also had some chest pain. Which came first, that shortness of breath or the chest pain?
The chest pain.
The chest pain came first?
Yes.
Okay, all right. Any extraneous activity more than normal? I know you said you were working, helping your husband on the car. So is that more than you normally do, or is that kind of normal for you?
No, that's like, I went on a hike yesterday, but it's pretty normal.
Okay, so you hike and all that stuff.
Yes.
That's nothing more than you normally do?
No.
Okay. Any increased stress? Like you've been under more stress than normal?
Work. But who's not stressed nowadays?
Okay. So, but we've been having quite a bit of stress at work?
Yes.
Okay. All right. Got a couple other questions. Any nausea, vomiting lately? Feel nauseous? You vomited?
No.
No, you haven't felt nauseated at all today? What about dizzy or lightheaded?
I got a little lightheaded.
You got a little lightheaded?
Yes.
Yeah, when did that happen?
I want to say around 3 o'clock.
Oh, okay, so that was kind of earlier than you actually called us, but that subsided? You don't feel that anymore?
No, not anymore.
What did you do to kind of fix that?
Drink some water.
You drank water, okay.
Yes.
You keeping yourself hydrated?
Trying to.
Trying to, okay. Couple other questions for you. I wanted to know if, have you had any kind of like energy drinks or like increased caffeine more than normal?
Define increased.
So, like, if you drink coffee every day, that would be normal, right? But let's say I had 5 cups of coffee today instead of my normal 1. So, do you have more caffeine or
Well,
more?
I normally have about 4 cups of caffeine a day.
Oh, wow. Okay.
So.
And so you already had that today?
I'm on my 3rd cup.
You're on your 3rd cup. So
One more to
go.
go.
Okay, all right. So not more increased than normal then?
No.
Okay, all right. So we already talked about that, our increased activity. What about any increased heavy lifting that you've been doing today?
Nope, just my husband's work because he sits down all day.
Yeah, but that's normal for you though. Not any increased heavy lifting?
Nope.
No, nothing like that. Any illnesses where you have like a cough or anything like that?
No.
No, nothing like that. Okay, so I've already asked more than my 5 clarifying questions, guys. So I'm gonna move on, I'm gonna assess the area. So at this point, I would lift up the patient's shirt. I would let them know, hey, I need to go ahead and take a look at your chest. On the chest, guys, we're looking for obvious things like bruising, maybe like cuts or anything that would be kind of concerning to us. Then we would palpate it just like we do trauma. Remember, for trauma, guys, we go our anterior to posterior and then our lateral to medial. So does any of that hurt at all?
A little bit, yes.
A little
There's
bit?
Some
Does it
pressure.
hurt worse? I'm gonna come up here because you said it actually was
Ow.
hurting up here. So it hurts worse when I push down?
Ow.
Okay, so it hurts when I push down, but not when I let go.
No.
Okay, all right. So I don't see any obvious bruising or anything, so kind of concerning that I can actually create the pain. So it could be something maybe you didn't hit your chest on anything.
Nope.
You didn't fall or anything when you're helping your husband. You didn't accidentally hit like the car.
No.
No previous kind of falls in the last couple days. Nothing that you hit the chest at all.
No, not that I can remember.
Not that you can remember. Okay, all right. So now I'm gonna assess and I'm gonna continue with my vital signs, guys. So with my vital signs, I now need to get my blood pressure. And I also need to get pupils. Now, I don't need a blood glucose level on this patient because of the fact that this patient is not diabetic. She's not altered. So I don't need to worry about that, okay? So remember with your pen light, guys, you would take your pen light, explain to your patient what you're doing before you do it. So let's start with blood pressure first. So I'm going to place my blood pressure cuff on my patient's arm. Does it matter which arm that I use for your blood pressure at all?
No.
No? Okay. So I'm going to go ahead and use this arm. Remember, guys, we're going to make sure that the artery is pointing where the artery is located. You're going to put that blood pressure cuff on nice and tight. Okay? I'm going to go ahead and I can stick this on my patient's shirt. And then I'm going to get my stethoscope out because we're going to get a blood pressure. Okay, so remember where your stethoscope goes. Okay, it's gonna go right below that artery area there. And then I'm gonna go ahead and get a blood pressure on my patient, okay? Okay, so we're assessing that blood pressure on our patient, and I'm gonna say that for this patient in particular, we get a blood pressure of 130/90. Okay, so the systolic's a little on the high side, and so is the diastolic. So we've got 130/90. All right, so we already assessed the blood pressure on my patient. Remember, it was 130/90. Then we're gonna assess pupils. So if you could do me a favor, if you can just look right here at my nose, I'm gonna shine a bright light in your eye. Please keep your eyes open though, okay?
Okay.
So I'm gonna go in, assess that pupil. I'm gonna go in, I'm gonna assess that pupil. So my pupils did react, so they're pearls, so my pupils are equal, round, and reactive to light. And again, like I said, we don't need to do a blood glucose level in this patient. She's not diabetic, she's not altered, and she's eaten recently. So that is the end of block 2.